There's something most people never suspect. Something many older adults keep within arm's reach, trusting it without question. It sits in bathroom cabinets, kitchen drawers, and bedside tables, taken casually for pain, stiffness, or everyday discomfort. Yet this common habit may be quietly weakening the heart over time, without obvious warning signs, until real damage is already done. What makes this especially alarming is that these are not rare or experimental substances. They are some of the most widely used medications in the world. Pills taken for headaches, joint pain, arthritis, muscle aches, stomach discomfort, or cold symptoms. Most people assume that if something is sold everywhere and recommended so casually, it must be harmless. That assumption has cost many older adults their heart health. The connection between these everyday medications and heart damage often goes unnoticed. Not because it doesn't exist, but because it develops slowly and silently. By the time symptoms appear, fatigue, swelling, shortness of breath, reduced stamina, the heart has already been under strain for months or even years. This is why so many people are blindsided, believing their heart problems came out of nowhere. What you're about to learn is not meant to scare you. It's meant to empower you. By the end of this video, you'll understand which common medications place the most stress on the aging heart, why the risk increases after age 60, and how small changes can dramatically reduce long-term damage while still managing pain and discomfort safely. Let's begin with medications found in nearly every household. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. These include familiar names like ibuprofen, naproxen, and diclofenac. They're incredibly effective at reducing pain and inflammation, which is why so many people rely on them daily. For short-term use, they often seem harmless. The problem begins when they become routine. After the age of 60, regular use of these drugs can quietly strain the cardiovascular system. This isn't speculation. Warnings about increased risks of heart attack and stroke have existed for years, yet many people still take these medications daily without realizing how deeply they affect circulation, fluid balance, and heart workload. Consider a typical scenario. An active older adult uses these pills to manage joint pain, allowing them to stay mobile and independent. Over time, however, subtle changes begin to appear. Energy levels drop. Breathing feels heavier during simple tasks. Ankles or feet swell slightly at the end of the day. These signs are often dismissed as normal aging, but they're anything but harmless. Here's what's happening beneath the surface. NSAIDs reduce inflammation by blocking specific enzymes. Unfortunately, those same enzymes also help protect blood vessels and regulate kidney function. When that protection is disrupted, the body begins retaining salt and water. Blood volume increases, blood pressure rises. The heart is forced to pump harder against greater resistance day after day. Think of the heart as a pump designed to handle a certain load. When extra fluid floods the system, the pump must work overtime. A younger heart may adapt for a while. An aging heart, already less flexible and often managing high blood pressure or mild weakness, may not. Over time, this constant strain can tip the heart into failure without a single dramatic warning moment. This is what makes the danger so deceptive. The medication doesn't feel harmful. Pain decreases. Life feels easier. Meanwhile, the heart is slowly being pushed beyond its limits. What appears to be relief on the surface may be creating deeper problems inside the body. And NSAIDs are only the beginning. Several other common medications can quietly weaken heart function in older adults, especially when taken together or over long periods. That's why understanding what you take, how often you take it, and how your body responds becomes increasingly important with age. In the next part, we'll break down the remaining medications that place hidden stress on the heart, explain why aging bodies react differently to them, and show you practical, safer alternatives that protect both comfort and longevity. This knowledge isn't about avoiding treatment. It's about making informed choices so your heart stays strong enough to carry you through the years ahead. The next part will reveal what most people never think to question, and why timing, dosage, and awareness matter more than you've been told. Another hidden danger of common pain relievers is how they quietly affect your blood vessels. These medications can cause blood vessels to tighten and blood pressure to rise. Even people who have never been diagnosed with high blood pressure can experience a significant increase with regular use. And if you already take medication to control your blood pressure, these drugs can silently cancel out its effects, allowing pressure to climb without any obvious warning signs. The risk isn't just about taking them once in a while, it's about how much and how long. Higher doses and frequent use dramatically increase the strain on the heart. Certain varieties are especially hard on the cardiovascular system, while others may appear safer on paper, but none are completely risk-free. What makes this even more alarming is that if you take a small daily dose of aspirin to protect your heart, some pain relievers can block that benefit entirely, leaving you exposed when you believe you're protected. The answer is not to live in pain or ignore discomfort. The smarter approach is awareness and choice. There are safer strategies that depend on your personal health history. In many cases, gentler pain options are enough. In others, treatments that work locally on sore joints or muscles can reduce pain without flooding the bloodstream. And when stronger medication is unavoidable, the guiding rule is simple. Use the smallest amount for the shortest possible time. Now we come to the next medication, and this one surprises almost everyone because it's marketed as a protector. These are the acid-blocking pills taken for heartburn, reflux, or stomach irritation. They're among the most commonly used drugs worldwide, often taken daily for years without a second thought. Ironically, something meant to shield the body can quietly weaken it in another way. Long-term use of these acid suppressors can drain essential minerals from the body, especially magnesium. Magnesium plays a critical role in keeping the heart's rhythm steady and coordinated. When levels drop too low, the electrical system of the heart can become unstable, increasing the risk of irregular heartbeats and other serious complications. This depletion often happens silently, without symptoms, until a problem suddenly appears. The reason lies in digestion itself. Stomach acid isn't just there to break down food, it's essential for absorbing nutrients. When acid levels stay suppressed for months or years, mineral absorption suffers. On top of that, research has linked long-term use of these medications with changes in blood vessel function, reducing flexibility and resilience over time. While scientists continue to debate the exact mechanisms, the pattern is concerning enough to deserve attention. Another overlooked issue is interaction. Some acid-blocking drugs can interfere with medications taken to protect the heart, reducing their effectiveness and leaving people vulnerable without realizing it. What makes this particularly risky is how casually these pills are used. They were originally designed for short-term relief, yet many people stay on them indefinitely for problems that could sometimes be managed through diet, timing of meals, and simple lifestyle changes. If you've been using these medications for a long time, the key is not to stop suddenly, but to reassess. Ask whether long-term use is truly necessary, whether the dose can be reduced, or whether alternatives exist. Ongoing use should always be paired with periodic checks of key mineral levels to avoid hidden deficiencies. Before we move on to the next group of medications, some of which are found in everyday cold and flu remedies, I want to pause for a moment. If this information is opening your eyes and helping you think differently about what you put into your body, now is the perfect time to subscribe. This channel exists to give you clear, practical health knowledge so you can make smarter decisions and protect your heart for the years ahead. The next part gets even more surprising, and it involves medicines most people assume are completely harmless. Before we move on, there's one more thing that truly matters. If this information feels important to you, please share this video. Think about your parents, your grandparents, or even a close friend. One simple click can spark a conversation that changes how someone takes care of their body. Awareness spreads faster than symptoms, and that alone can make a real difference. Thank you for being part of that. Now let's talk about something almost everyone has used at least once without a second thought: cold and flu decongestants. The kind you grab quickly when your nose is blocked and breathing feels impossible. Many of these products contain ingredients like pseudoephedrine or phenylephrine. They work fast, they feel effective, and that's exactly why they're risky. For someone in their later years, these medications can place enormous strain on the heart. Take Margaret, a retired teacher in her mid-70s. She caught a bad cold and picked up a popular decongestant so she could sleep and breathe more easily. Within 2 days, she felt intense dizziness, pounding heartbeats, and a crushing headache. What started as a simple cold quickly turned into a frightening emergency. The reason is how these drugs work inside the body. They narrow blood vessels to reduce swelling in the nose, which is why breathing improves. But they don't stay in the nose. They travel everywhere. Blood vessels tighten throughout the entire body, forcing the heart to push harder and faster. Blood pressure can spike suddenly, and the heartbeat can become irregular. For an aging heart, that combination can be dangerous. These medications also act as stimulants. They increase alertness, speed up the pulse, and place constant stress on the cardiovascular system. In some cases, they've been linked to serious complications involving blood flow to the brain. What makes them especially risky is their easy availability. They sit on pharmacy shelves, no warning bells, no hesitation at checkout. For older adults, especially those with any history of blood pressure or heart issues, these decongestants can do far more harm than good. Gentler options like saline sprays, humid air, or locally acting nasal treatments can ease congestion without stressing the heart. Relief should never come at the cost of long-term damage. From physical health, we move into a topic that's often whispered about but deeply connected to the heart: mental health. Some older medications used for mood or chronic nerve pain belong to a class that can quietly destabilize the cardiovascular system over time. Frank, in his late 70s, struggled with nerve pain in his feet. The medication helped the pain, but something else began to happen. Every time he stood up, the room spun. One day, he lost consciousness and fell, fracturing his hip. The medication had caused a sudden drop in blood pressure when standing, leaving his body unable to adjust quickly enough. But that wasn't the only issue. These medications can also increase resting heart rate, keeping the heart under constant strain. Even more concerning, they can interfere with the electrical signals that control heartbeat rhythm. When those signals slow or misfire, the risk of dangerous heart rhythms rises sharply, sometimes without warning. That's why these drugs are no longer considered the first choice for emotional well-being in older adults. Safer options exist today, and awareness is key. Emotional health and physical health are deeply connected. Supporting one should never quietly damage the other. And now we arrive at number 1. This is the most controversial topic on this list, and the one that surprises almost everyone. It's something millions of people take every single day with the best intentions, believing they're protecting their future. Calcium supplements. For years, the message was simple and reassuring. Take calcium for strong bones and protection against fractures. But the conversation around calcium is changing, and that's where the next part begins. In recent years, a growing number of findings have raised serious questions about the long-term heart safety of calcium supplements. Let me share the story of Linda, a 70-year-old woman who did everything she believed was right. Concerned about osteoporosis, she began taking a high-dose calcium supplement on her own. Years later, she suffered a heart attack that seemed to come out of nowhere. She didn't smoke. Her blood pressure was normal. Her cholesterol was under control. When her history was carefully reviewed, that daily supplement stood out as a possible contributor. The concern isn't calcium itself. Calcium from food sources like dairy, leafy greens, nuts, and vegetables doesn't appear to pose the same risk. That's because dietary calcium is absorbed slowly and used efficiently by the body. The problem may arise when calcium is taken in large concentrated doses from supplements. A pill can cause a sudden spike of calcium in the bloodstream. Your bones can only absorb so much at once, and the excess has to go somewhere. The fear is that this excess calcium may deposit in the walls of arteries, a process known as arterial calcification. Over time, this can stiffen blood vessels and contribute to plaque formation, increasing the risk of heart attacks. Some large studies suggest calcium supplements slightly raise this risk, while others show mixed results. The evidence isn't black and white, but the concern is real enough to demand caution. For people with diagnosed osteoporosis, the benefits of supplementation may outweigh the risks, but the takeaway is clear: more is not better. Calcium should come from food whenever possible, and supplements should never be started casually or without proper guidance. Bone health and heart health must always be considered together. Today, we've uncovered the hidden side of 5 extremely common substances many people take without hesitation: anti-inflammatory pain relievers, stomach acid blockers, cold and flu decongestants, certain older mood medications, and calcium supplements. This message is not about panic. It's not about stopping medications abruptly. Doing that can be dangerous. This is about awareness and empowerment. You now understand that a pill taken for joint pain can overload the heart, that a so-called stomach protector may quietly affect heart rhythm, that a simple cold remedy can trigger serious cardiovascular stress. This knowledge puts you in control. It allows you to become an active partner in your own health instead of a passive consumer. The next time you have a medical appointment, go prepared. Bring a complete list of everything you take, including supplements and vitamins. Ask direct questions. Is this still the safest option for me? Are there alternatives? Should anything be monitored more closely? Every treatment is a balance of benefit and risk, and that balance changes as we age. Your heart has worked non-stop for decades. It deserves careful attention and respect. Protecting it is one of the most powerful investments you can make in your future. Never assume a medication is harmless just because it's common or familiar. Before you go, share your thoughts in the comments. Did anything here surprise you? Your experience might help someone else make a safer choice. And remember, informed conversations are the first step toward long-term heart protection. Take care of yourself, and I'll see you in the next video.